Stroke damages brain cells responsible for movement, speech, memory, and daily functions. Rehabilitation takes time because the brain must rebuild or reroute these lost connections. This process depends on the severity of the stroke, the area of the brain affected, and the patient's overall health. Immediately after a stroke, the brain is in a fragile state, and swelling interferes with normal function. As swelling decreases, some abilities may return quickly, but deeper recovery requires weeks or months of repetitive training. Rehabilitation aims to help patients relearn skills or develop new strategies to compensate for lost abilities. Since no two strokes are alike, no two recovery timelines are identical. Good rehabilitation requires consistency and structured therapy, often supported by a coordinated medical team. In the first 72 hours after a stroke, the focus is on stabilizing the patient, not on active rehabilitation. Doctors work to protect the brain from further damage, restore blood flow, and prevent complications. During this stage, patients may regain small functions naturally as swelling decreases. Early mobilization, such as sitting up, gentle movements, and simple exercises may begin if medically safe. Although improvements can be seen early, this period is too soon to predict long-term recovery. However, quick stabilization and early intervention strongly improve long-term outcomes. Families often feel anxious in this stage, but it is important to remember that real rehabilitation starts shortly afterward. During the first 2 weeks, stroke rehabilitation officially begins. Therapists evaluate mobility, speech, swallowing, and cognitive abilities. Patients may start physical therapy to regain strength, sitting balance, and basic movements. Occupational therapists focus on daily activities such as bathing, dressing, and eating. Speech therapists address communication or swallowing difficulties. This early stage is crucial because the brain is highly responsive to repetitive stimulation. Patients often make noticeable progress during these first weeks. Whether the patient returns home or enters a rehab center depends on the severity of the stroke. Motivation and family support during this period greatly influence long-term recovery success. The first 3 months after a stroke are considered the golden period for rehabilitation. Neuroplasticity, the brain's ability to reorganize itself, is at its highest. Patients may recover walking ability, hand movement, speech clarity, memory, and problem-solving skills during this time. Therapy intensity is highest in this phase, often involving daily physical, occupational, or speech sessions. Since progress slows after 3 months, maximizing this period is critical. Even small improvements during this stage often lead to major gains in independence. Patients who work consistently with therapy teams tend to experience the best functional recovery. From 3 to 6 months, recovery continues but at a slower pace. Patients refine movements, strengthen weak muscles, and improve coordination. Speech and cognitive abilities also advance during this stage, although progress may be more gradual. Most patients can see improvements in endurance, balance, walking stability, and daily activity performance. Although some believe recovery stops after 6 months, research shows this is not true. Progress simply becomes more subtle. Consistency remains the most important factor. Patients who maintain therapy at home or in outpatient centers continue gaining skills that improve independence and quality of life. Beyond 6 months, stroke survivors enter the long-term rehabilitation phase. Neuroplasticity still occurs, but at a slower rate. Patients focus on regaining fine motor skills, improving speech fluency, and increasing strength for daily tasks. Many start more advanced tasks such as cooking, writing, climbing stairs, or returning to part-time work. Cognitive rehabilitation becomes important for individuals with memory or attention issues. Emotional recovery is also crucial. Depression and anxiety are common after stroke. With continuous therapy, many people regain independence around the 1-year mark. However, full recovery may take longer depending on the severity of the stroke. Yes, recovery can still continue after 1 year. Although progress is slower, the brain remains capable of learning and adapting. Patients who continue practicing rehabilitation exercises often regain additional function even after several years. This includes improved walking, stronger hands, clearer speech, and better cognitive performance. The key is repetitive training. Studies show that consistent daily practice, even 20-30 minutes, can lead to measurable improvements. Patients should not assume that progress stops after 12 months. The brain continues to heal as long as it is stimulated. Several factors influence how long stroke rehabilitation takes. These include severity of the stroke, location of brain damage, age of the patient, overall health, diabetes, hypertension, heart disease, motivation and emotional resilience, consistency with therapy, family support. Patients with milder strokes may recover within weeks, while those with severe strokes may need years. Younger individuals tend to recover faster due to stronger neuroplasticity. However, even older adults can make significant improvement with proper rehabilitation. The key is persistence. Stroke rehabilitation includes multiple specialized therapies: physical therapy, strength, balance, walking, occupational therapy, daily tasks, hand function, speech therapy, communication and swallowing, cognitive therapy, memory, problem solving, psychological therapy, emotional support, advanced technology, robotic training, electrical stimulation, virtual reality. Each therapy targets different functions and accelerates recovery. Combining therapies provides the best results. Modern rehabilitation technologies have greatly improved outcomes for stroke survivors. Stroke rehabilitation is a long journey, but recovery is always possible. Some patients improve within weeks, some within months, and others continue gaining strength for years. The timeline varies, but the key principles remain the same: early therapy, consistent practice, emotional support, and long-term persistence. Stroke may change a person's life, but it does not end their potential for progress. With the right therapy and determination, patients can rebuild independence, confidence, and quality of life.